Radio, BBC Radio Scotland.
You're listening to Good Morning Scotland. The time now is 24 minutes to 9. Across the BBC, we're calling the next 7 days NHS Week. And this morning, we thought we'd compare the NHS in Scotland with the rest of the UK. And let's get the views of Professor Jamie Weir, who chairs PAC. That's an independent group of Grampian patients, but has also worked within the health service as a radiologist and as a member of Grampian Health Board. Good morning to you.
Good morning.
And also, we have Professor Alison Pollock, who's Director of the Institute of Health and Society at Newcastle University and formerly taught health policy at Edinburgh University. Good morning to you.
Good morning.
So, Alison Pollock, since you're in Newcastle now, you did teach health policy at Edinburgh. How do the two systems, or services rather, compare?
Well, I think there's a very important background message to this story, which is that the NHS in England was abolished by the Health and Social Care Act in 2012. So what's happening is in England, the NHS is now rapidly being dismantled and privatised, both the delivery and opened up to user charges and changes in funding. And that has a big impact for Scotland, Wales and Northern Ireland, which still have their NHS, because the funding for the NHS in Scotland, Northern Ireland and Wales comes through something called the Barnett formula. So we already have a problem because Scotland is going to suffer under the Barnett formula, known as the Barnett squeeze. So the amount of money that it gets from the Treasury is being reduced. But also, as the NHS is being dismantled in England, funding is being withdrawn from both the NHS and social care, which means that translates into the Barnett formula into a real reduction in funding for the countries that still have a national health service. So, nevertheless, Scotland is still much better placed than England and indeed Wales at the moment. So Scotland is in a much stronger position than England with respect to both health and social care.
And Professor Jamie Weir, is that something that you would agree with?
We are slightly better off in terms of the amount of money coming per capita. But if you look at the overall statistics in terms of the services that can be offered to patients, and you compare it not only to England but also compare it to what we should be doing, is looking at other countries, OECD countries, France, Germany, etc. We are so under-resourced and have been for the last 10 to 15, even 20 years, that the crisis point that's been reached in England, it's not going to be long before we're in exactly the same position in Scotland.
And what is the impact, just staying with you, Professor Weir, when you say crisis, in what sense, does that manifest itself?
Patients want to be able to have reasonable and simple access to primary care, to have simple transition through to secondary care when they require it, no blocks in the system. At the moment, we have enormous amount of waiting lists. We have cancelled operations. We have closed beds. We have bed occupancy, which is far greater than acceptable levels. And there is no extra capacity in the system whatsoever. So, and this is a result of under-resourcing. You only have to look at all the statistics that come out from Europe and from Great Britain to understand the problem. We have just over 2 doctors per 1,000 people in Britain. If you go to France, you have nearly 4. If you go to Germany, you have nearly 5. If you've got a number of hospital beds, for example, you have about 3 in the UK and 8 in Germany. Is it any wonder that patients cannot get access when they need to?
Professor Alison Pollock, just listening to Professor Weir, Jamie Weir there. I mean, do you see a health service in the same state in Scotland?
Well, there is indeed under-resourcing, and I agree with everything that Jamie is saying. But the problem is, at the moment, is that the English government is not committed to a national health service. It has abolished the national health service. The Secretary of State for Health there has no duty to provide a national health service in England. So the money is now being withdrawn from the National Health Service in England. And as it's withdrawn from England, the Treasury at the same time is also withdrawing the funding from Scotland. Now, Scotland still has a national health service, but if it's going to retain a proper national planned health service, it does indeed require more funding to come in, but that ultimately is going to be a Treasury decision.
Except we saw the Scottish Government, didn't we, Alison Pollock, last week in the budget, saying that there would be more money for the NHS.
Well, that's true, but there's only a limit as to what it can do with the pot of money that it gets from the Treasury, and that is being squeezed because basically the Scottish Government gets what's called almost like a block grant from the Treasury under the fiscal settlement, but it has very little power to alter the size of that grant. It can only move the budget around, as it were. It's got very limited tax-raising powers. So actually, whatever happens in England, and the dismantling is happening very rapidly. If you think there's a crisis in Scotland, it's nothing like what's going on. And I'm here south of the border, both at times in London and in Newcastle. It's nothing like the scale of the devastation that is being now wrought in England, which is why we need the NHS in England restored, so that then the politicians south of the border will be committed to an NHS, and then the funding will come back in.
Do you think, let me just bring in Professor Jamie Weir finally, I mean, do you think it is dependent on what happens in England, how the NHS in Scotland progresses then?
To a certain extent, yes, but I think that we need to move on slightly. And the funding, yes, I agree, but we have to look at what's going to be required over the next 25 to 30 years for patients. Look at the demographics, look at the age distribution, look at what is necessary. And tinkering with small amounts of money here and there, which is often not new money, it says it is, but it isn't, we need to be able to look at the total infrastructure. And I don't believe that it's going to survive the NHS as it is, free to the point of care, at the present levels. It cannot do so. We cannot go on with the position whereby patients, and we have lots of patient stories. One person, for example, has been sent home 5 times with a fractured arm because there isn't a bed for them. You cannot do that in the long term. You've got to be able to look at the long-term prognosis of this.
Professor Jamie Weir, thank you for joining us. We also heard from Professor Alison Pollock.